Okay, so if you thought you had your summer food and pool safety totally locked down, well, you might want to rethink your plans just a bit. Let's dive right into this explainer, where we're tracking a rapidly spreading microscopic public health threat. It is literally turning the season of relaxation into a total medical ordeal for a whole lot of people right now. You know the vibe. You might be picturing an absolutely idyllic afternoon, eating fresh berries by a chlorinated public pool, maybe digging into a cool caprese salad with some fresh basil. Sounds like the perfect summer day, right? So, what ruins it? Well, there's actually a hidden antagonist lurking right now in those exact summer staples. Over 1,700. That's the staggering number of people already hit by a massive outbreak of severe diarrhea, all caused by a sneaky little parasite called Cyclospora. And while cases are definitely climbing across states like New York, Texas, and North Carolina, the epicenter is heavily concentrated in the Midwest. Michigan alone has seen over 1,500 cases, with nearly 200 more right next door in Ohio. And get this, even the CDC admits their national count is likely lagging way behind the reality on the ground as these state numbers just keep surging. Section 1. Symptoms and severity, not your average bug. Now, if you catch a normal stomach bug, say norovirus, you're usually looking at a rough 24 to 48 hours, right? Then you bounce back. But cyclosporiasis? Man, it is a completely different beast. We're talking about weeks, sometimes literally months of relapsing, watery diarrhea, intense cramping, and bloating. It doesn't just pass quickly, it lingers, leaving people severely dehydrated. In fact, this parasite has already hospitalized over 70 people in Michigan and Ohio alone. It is absolutely relentless. Just listen to Dr. Caitlin Rivers, an epidemiologist over at the Johns Hopkins Center for Health Security. She points out that it's this relapsing pattern that's so incredibly draining. You think you're finally getting better, you let your guard down, only to get slammed with the symptoms all over again. It's a total marathon for your immune system. Section 2. How the parasite spreads, a stealthy threat. So here's a crucial point to understand. You can't actually catch Cyclospora just by standing next to someone who's sick. It doesn't pass directly from person to person like a cold. Instead, Cyclosporiasis is contracted by consuming a contaminated environmental vehicle, specifically produce or water, that was actually infected weeks prior. You're basically ingesting these microscopic spores directly from your environment. And here is where things get truly alarming. It is completely resistant to bleach. Yeah, you heard that right, no way around it. Because this parasite actually survives standard chemical treatments, it can easily live in heavily chlorinated public swimming pools, splash pads, you name it. Suddenly, those fun public recreational waters become a massive blind spot for your summer safety. Section 3. Safe Food Prep Guidelines, your defense plan. Okay, so when it comes to fresh fruits and veggies, the absolute safest way to kill off Cyclospora is to apply heat. The Michigan Department of Health and Human Services highly recommends cooking your produce to an internal temperature of 158 degrees Fahrenheit or higher. Honestly, grabbing a trusty food thermometer is your absolute best bet to guarantee you've hit that safe threshold. But obviously, you aren't going to cook a crisp summer salad, right? That defeats the purpose. So for raw foods you just can't cook, researchers have tested a specific rinse. Gently swishing your greens in a mixture of 1 part vinegar to 3 parts water has actually been shown to remove most of the Cyclospora spores. Immersing the produce and then giving it a good whirl in a salad spinner, that can be a really effective tool for this whole process. We definitely need to read the fine print here, though. Rinsing helps, sure, but it's not 100% reliable. You got to keep in mind that Cyclospora spores are exceptionally sticky, way stickier than your typical everyday parasites. So while washing diligently with vinegar or breaking off and tossing the outer leaves of your lettuce and scrubbing firm fruits with a brush all definitely help reduce your risk, washing alone just isn't a perfect shield. Section 4. High-risk foods to avoid, the do not eat list. Listen, if you have lowered immune function, maybe due to age or certain medications you're taking, you really need to know exactly which raw foods carry the highest risk during an active outbreak like this. Take a close look at these common culprits. Berries like raspberries, fresh herbs like basil and cilantro, and leafy greens, including salad mixes and snow peas. Notice a pattern? What do all these have in common? They've got super delicate textures or lots of tiny little crevices, which makes them notoriously difficult to wash thoroughly.
If you are vulnerable, it might seriously be best to steer clear of these entirely until the outbreak fully subsides.
Section 5. Diagnosis and treatment. The medical protocol.
Now, if despite your absolute best efforts you actually begin exhibiting symptoms, you need to know exactly how to navigate the healthcare system to get some relief. Step 1, watch the clock. If your diarrhea lasts over 48 hours, it's time to head to the doctor. Step 2, you must explicitly request a special Cyclospora test. Your standard test for a run-of-the-mill stomach bug will completely miss it. Plus, because this parasite sheds intermittently, you might actually need several tests, spaced 24 hours apart, just to get an accurate diagnosis. You really have to advocate for yourself here. And step 3, once you're officially diagnosed, you'll check a 7 to 10-day course of a specific combination antibiotic known as Bactrim Receptra.
So why is this specific medical protocol so absolutely crucial? Well, as infectious disease expert Dr. Rebecca Shane points out, getting proper medical treatment is vital for two big reasons. First off, the illness is incredibly uncomfortable and just lasts way too long for you to try and tough it out. But more importantly, if we don't treat it with antibiotics, the infected person just keeps shedding the parasite, which increases the spread right back into the environment. So getting treated actively protects your whole community.
So we're going to leave you with this thought today. Knowing that this microscopic parasite aggressively resists the bleach in our pools and clings so stubbornly to our favorite summer salads, how are you going to change your habits this summer? We really hope the insights in this explainer empower you to stay vigilant, rethink your kitchen prep, and above all, have a happy, safe summer out there.